Well, hey, we're back on. It's been weeks and I've missed you guys. Thanks for being patient. We had some family visitations for Thanksgiving. I hope you all had a great Thanksgiving. We went up to Tennessee to visit my son and daughter in law and two grandkids. And all of that takes time through Wednesdays and everything, but we're back. And one of the questions that I keep getting asked is about COVID 19 because it's back in the news again. Just when you thought it was safe to go out, for some of you in some states, you can't go out. In fact, it's getting kind of restrictive once again. Hello, everybody. I'm Dr. Jerry Cartsinell. I'm board certified pediatrician, taking care of children with autism and all kinds of special needs, and sometimes their parents too. But generally, I get the privilege and honor of working with our kids and their immune system issues and allergies and everything that's going along. And the question I get asked all the time, are they more susceptible to getting infected with COVID-19? And the short answer is if you have a child with a compromised immune system, then chances are probably they might be more susceptible. On the other hand, children overall, even now after the ability to research the data, the children under 16 generally just don't get this disease. And if they do, it's very mild. Children tend not to be spreaders. In other words, that they don't act as a vector. Yeah, they don't get sick, but they pass it on to their adult teacher or adult care worker. It's just not showing up in any of the numbers. So that's the good news for many of us. Now, as parents, as grandparents, and parents, then we start worrying about the effects of COVID-19. Uh, the good news is that through this pandemic, as it's referred to, the overall death rates, wherever you look, wherever there's a database, haven't increased, which is very exciting news. In other words, as I was reading earlier this morning, 1,700 people are expected to pass away every day in England. And in the United States, 7,700 deaths every day in the U.S., which comes up to 2.8 million people per year. But think 7,700 deaths every day. And no matter what database you look like, you don't have an opportunity to see it go into 10 to 12 to 15 in a day, because you would think if this is becoming such a lethal issue, there would be what they refer to in medicine as an excess of deaths, like say a tsunami causes the loss of 200,000 lives in a day, in a matter of hours, then that you would see. But this does not seem to be doing that. So that's really good news on the front. We're doing a good job with people staying alive. The news also, the data also holds out that it's still elderly folks, especially over 80, that should they get the disease, they may pass away. But generally, the elderly have other disease entities going along, maybe hypertension, pulmonary emphysema, something else is going on in their lives, and this just happens to come along and maybe complicate. As far as I could see, still today, and this is kind of interesting, guys, how does COVID 19 kill you? How does it do it? And you're not going to be able to see that yet. The answers are not in. Does it cause blood clots? Does it cause kidney failure? Does it cause you to stroke out? Does it cause the heart to stop? Isn't that interesting that they still don't know how COVID 19, if it does, if it's responsible for deaths, how it actually does it yet? So that's going to come from tissue samples from autopsies. And again, for some reason, that data, those studies, they're not being done yet. And so I can't tell you what's happening along that realm. Let's see, what else? There are concerns about how this pandemic is being categorized. In other words, about 8 years ago, a pandemic was considered a worldwide disease with serious illnesses and death being changed to just a worldwide disease. So a pandemic is a worldwide disease. Interesting when you start looking at using that same type of nomenclature, that same type of definition. Why isn't autism considered a pandemic? Nobody talks about autism as being a pandemic. A larger number of cases than you would normally expect, and yet nobody talks about that. So I have some problems in that the same way that they look at a disease process like COVID-19 affecting individuals in a pretty significant way, not looking at autism that same way. The mortality of coronavirus, again, some studies are showing it's pretty much still equivalent to what you see with a nasty seasonal flu. And notice we're not hearing too much about a seasonal flu right now. It really is focused, the media and everything is focused on COVID-19. So we also want to think about treatments, and I always get asked about treatments. What do you do once you get it? And fortunately, like I said, I've only had to work with a couple of kids so far who did get it, and it was becoming a little bit significant in their course. None of them had to be hospitalized, probably because most of my patients, as many of you know, we're going to be up on, not just start because I'm feeling sick, but we're taking our vitamin D every day, okay? And more studies are showing that vitamin D protects you from the ravages, if you will, of COVID-19. I'd love to see the ratio of deaths compared to vitamin D levels, okay? And you're not going to see that, but I'm just suspicious of that. But vitamin D, very, very important for all of us, especially the older you are, the more diligent you have to be about remembering to take your 5,000 IUs of vitamin D3 every day. Zinc, anywhere between 40 and 50 milligrams a day for adults, okay? Selenium seems to be very, very helpful with that as well. And vitamin C. So when you look at what researchers or doctors who are actually working with patients with COVID-19, they're talking about medications like hydroxychloroquine that has been helpful for many, giving them asthma breathing treatment with steroids like budesonide over a nebulizer seems to be very, very helpful. I just read about ivermectin, and ivermectin is what I give my German Shepherd once a month, Hero, to protect them from heartworm disease. And you can get it online, from a tractor feed store, and you get a little bottle of it. So ivermectin is what I use for Hero, but it seems to preliminarily, or very interestingly, there's some studies being done on seeing if this too would help in the therapeutic intervention of a SARS infection, COVID-19 infection. So that's coming along. Taking natural supplements that help minimize a cytokine storm, and there are several products out there. I use a product by Research Nutritionals called Cytoquel, and that's going to be very helpful in mitigating an overachieving immune system. What do I mean by an overachieving immune system? When you think about it, the people who are allergic to peanuts or bee stings, what happens is your immune system goes into hyperdrive, and actually the end result is it can kill you unless you get a shot of adrenaline, epinephrine, and steroids. Okay, so your own immune system will take your life. We call that anaphylactic shock, an overachieving immune system. And that's been kind of a concern about some of the vaccines that have come out there, like for AIDS. The reason why we haven't been able to bring the AIDS vaccine to market is because it seems to cause what they've termed an enhanced immune response. All right, and therefore we haven't been able to bring something like to market. Every time they develop something like that, we get into this problem, and that enhanced immune response, the next time that person's exposed to the particular virus, the immune system goes into overdrive and can make you very sick. So the next thing I'm asked about is the COVID virus vaccine. That sounds like it's going to be available in the next week or two, from what I'm hearing in the grapevine. And people who are frontline providers in medicine, whether they work in nursing homes or emergency rooms or clinics, are going to be asked to receive this vaccine as well. So that's coming, and some people will have a choice and to have this vaccine, and some will not. Say our service members in the military may not have an opportunity to say no, because when you're in the military, you don't have an opportunity to say no, and they tell you you need to have this vaccine, you get this vaccine. Other people who are working with people in the healthcare industry may be told if you don't have the vaccine, you've lost your job. In other words, they will get fired from their position if they don't have this vaccine. So there's going to be some interesting developments over the next few weeks on how this is being distributed. The side effects of the vaccine, there are many, and from just pain at the injection site to a whopping headache. You're going to need 2 of them, it looks like. You need one, and then you're going to need a follow-up vaccine. I can't remember what they're going to recommend 6 to 8 weeks later. So it's a 2-dose protocol for this vaccine. And again, it's not going to be available to everybody at any time. They're going to have a tiered method of distribution. So for those of you who are concerned about that, again, for children, right now the vaccines from the last packaged insert label I've read, 16 and older. So for some of you who are concerned about giving a vaccine to a child on the spectrum, or any child under 16, it looks like they're not going to be included in this first big push. I think it's going to be more toward adolescents, late adolescents, and of course everyone else. So we know that there are going to be some side effects, and that include headache, fever, chills, body aches, the usual bad actors that are possible with vaccines. The idea that people are talking about the statistics that we're seeing with the way they count the number of cases can be kind of alarming. And Mark Twain said there are lies, there are damn lies in their statistics. Let me illustrate that. Say, for example, I'm going to go out and count 100 people and see how many left-handed people there are. Left-handed people. Okay, and I'm just going to pick a number. So out of 100, I find 10. Okay, and today, day 1. Day 2, I go out and count again 100 people, and I find 10. And if I start putting this on a graph for you, it would look like this. Day 1, I count 10 people. Day 2, 10 people. Day 3, 10 people. And if I keep accumulating them, it looks like there is a massive increase over time in 10 days. How many people are left-handed? But if you think about it, it's still 10 per 100, so it hasn't changed. But I can kind of give it to you in this form, and it makes you think there's a huger problem than there is. Now, think about it this way. Say I hire 3 people to go with me, and each of those 3 people are going to count 10 people out of 100. Now I'm going to have a jump of 40 more today because I had 4 people sampling, and all of a sudden it's looking like we're reaching a peak here. And we have to be very careful when we look at the data that it's being presented to us in an honest way. This is a dishonest way to present data. When you look at something a little more complicated, this is a graph looking at raw data, but it can serve to incite panic and despair. And I definitely don't want any of you becoming fearful or despairing about what you're hearing about the number of cases. So the actual case rate, you can see in the dark blue there, it seems pretty manageable. That would be representative of what I just showed you if I just showed you 10 per 100 Monday, Tuesday, Wednesday, Thursday on the previous graph. That line would be horizontal. But there are different ways that we can show this. And what happens is when people don't know how to read graphs or interpret data, then you have governors deciding how our service people shall serve you. This was in Maine, where the governor decided that people who serve food should have their air that they breathe out go upward and stay away from the consumers, as if that's going to to be of help. So I thought that was a little funny way of doing it. But what happens is that if we present data in an incorrect way or a misleading way, people who are in charge of us, politicians, will look at that and say, well, let's make a new law. We can't eat inside, or if we do eat inside, the servers have to wear, we used to call that the cone of shame. You know, when a dog got its ears fixed or something like that, you'd have to put this cone on to keep them from getting at their ears. But at least this was a nice Christmas color to make you feel really good. But sometimes we make public policy based on not the best data, and of course that transmits into pretty much people going, I don't understand why we were having to do this. Hi, David.
Hello.
He's just switching now to Facebook.
And while I'm here, make sure you follow us on MeWe. Just search for Mending Naturally. We don't know how long we're going to be on Facebook. You know, everyone's getting kind of weird, so make sure you have alternative sources of communication. So check us out on MeWe.com if you're so inclined.
Very good. That was a free public service announcement brought to you by David Cartsinell. All right, so we're going to get to the part now. Let me see if I have any questions on Facebook. And David's looking for that.
Facebook is changing how things look. It makes it hard to do from the side. So I'm going to be in here while he talks.
He's going to be in my background. So let's again talk about where we are with our kids in making them as bulletproof as they can for infectious disease, including the coronavirus. The influenza virus is out there, but you're just not hearing about it. So depending on the age of the child, you know, I take care of babies down to 6 months, 3 months, whatever. We just have to be very careful about what we do with them. So it's hard for me to give you actual doses. You know, how much would you give a 6-month-old child of vitamin D or zinc, or how much would you give a year? You have to, you know, also ask the question, what are we trying to protect them against? So let's go ahead here. And oh boy, we got some questions for us. Let's say hi to Zizo and Viviana and Despina. Hey, Despina. And Robin and Pam. Glad you're all here. So, and Carlina. Let's go down to the questions now and figure out what we can do for our kids. Hey, I'm going to go start with Zizo. Hello, Zizo. My son, 9 years old, with ASD, with apraxia of speech. We started the B12 shots 8 months ago. After 6 weeks, he started to imitate some words, and then he stopped. Any idea what happened? Well, that's good news, meaning that there are sounds that he can make, and we tickled the right parts of his brain for a little while, and then we lost it again. So, you know, it's not just B12. That's just one player in the whole cascade of trying to recover language. Apraxia is Latin. It just means not speaking. It doesn't mean that they can't speak. It just is a fancy way of coding for the speech pathologist. Instead of saying, I have a 4-year-old child with autism who's not speaking, they'll say, I have a 4-year-old child with apraxia. Doesn't that sound cooler? Apraxia. But don't worry about that title. It doesn't mean anything. With respect to our kids, I did a whole talk that you can find on Mending Naturally on speech and the medication supplements that I use for language. Okay, that include leucovorin, which is a very special form of vitamin B9, folinic acid. That can be crucial. Carnitine is very important for more than 50% of the kids that I take care of. I measure their carnitine levels and they're low, and I put them on carnitine and they can start speaking. Omega oils are crucial. Phosphatidylcholine. So there are a lot of the good news is you only started with one thing, and it's kind of like fishing. You got a bite on a line, but you lost it. Okay, it was on for a little bit, and then you lost it. But we can figure out a sharper hook, better bait to get that fish landed. In other words, get that language going. But I do have a whole talk on language or speech, and it's complicated, and it takes a while. Remember, and that was the other thing too. You did something for 8 months. I don't have that kind of patience. I'm a guy, man. I want to see something happen quick. If what I'm doing is not working in 6 to 8 weeks as far as language, I'm making changes. I'm adding things. I'm doing something. I'm not going to just sit there and say I'm doing B12 and that's that. So the good news is you only started with one thing, and there's a lot more to be had. So get busy, and you might need to have a practitioner help you with that. But be sure to take a look at my talk on speech, language. I think we talked about 30 minutes and had a whole bunch of things that you can do without a doc. And then there are some things you need to have a doc involved. All right. Desmina says, autism is the real pandemic. Well, the interesting thing about that too, and this I'll try not to get too agitated about it. Coronavirus, as bad as it is, as many people that are involved with dying with it and all like that, it will come, it will go. But our autism stuff isn't going, is it? I mean, man, it is day after day, week after week. With a pandemic like COVID-19, trillions of dollars are being invested in it. We're getting warp speed this and warp speed that. And what are we getting for autism? Right? Nothing. I mean, the crickets are out there. I used to joke and tell people 20 years ago, when they'd say, well, why this and why that? And I'd say, ask me in 20 years. We'll have the research and we'll know. Well, it's been 20 years. Nobody's doing any research. I mean, when you guys go on the internet and you guys search for something about your child and you're reading about it, it's not coming from UCLA or Syracuse or, University of Southern California or UC Davis. Nobody's doing anything. When I read my pediatric journals, there's nothing on it except for maybe some new metric test to decide if this child has autism or if this child's at risk for autism. But what about treatments? Tell me, what am I going to do with constipation? What am I going to do with diarrhea? What am I going to do with the inflammatory bowel disease, the autoimmune disease, the apraxia, the non-speaking? What am I going to... Oh, well, they just need 30 hours of ABA therapy a week, an hour of speech therapy a week, maybe some OT, and that's all we got. And you're still young. You can make some more babies. That's what they're still saying. And it's like, nobody's talking about gluten-free, dairy-free diets. Nobody's talking about B12. So, yeah, I get that. Alrighty. So I agree with it being the pandemic. Let's see, Robin, that was a great chart. Yeah, I thought that was kind of fun to see how they do things. Let's see here. Thank you for breaking it down. Good enough. Hi, Julie. Yeah, I miss you guys too. Merry Christmas. I still have Noah's Nutcracker. Tell my. Okay. And let's see what else we got here. Ashley. Hi, Ashley. Are you worried about the reports of post-inflammatory response uh, to? Oh, you just jumped out of there. Okay. Post-inflammatory response to almost everything, especially viruses. Is there any evidence that COVID could be more dangerous for post-response than others? Again, the data that they're collecting is very sparse. There's just not enough. That's a great question. Uh, Again, they're not even telling us the results of autopsy. Like the. And I know this is gross for many of you guys, but when we look at when we do an autopsy, they look at all the tissues. They do tissue samples. They do chemical analysis of what's going on. Was the end result of this? Like for example, measles. When the measles virus kills, it very often causes the blood to coagulate, to clot, and it's like jello, so it doesn't pass through the brain, and the brain becomes, lack of oxygen, and the child or adult passes away. So it's the morbid side, medicine. But we study that so we know what we could do to prevent it, okay? So if there's an inflammatory condition, then we know what we can do to prevent it and put them on things that lower the cytokine response or steroids that lower the immune response. So there's good to be gotten from it, okay? We don't know. Am I worried about the post-inflammatory response? Yeah, and who's going to get that? Fortunately, again, your child's a little bit different, obviously, but fortunately, the virus will come and the virus will go in most people, just like a cold will come. But I've had kids with common colds get that post-inflammatory response that'll knock me back on my chair. So that can be kind of concerning as well. Let's see what happened to my picture. There we go. So we just have to be very careful with how we work with the kids and what can we give them to minimize a post-inflammatory response before they get sick and when they are sick. So that's a great question. Am I worried about it? Yeah. Do we have any data on it? No. I mean, hardly any kids are getting sick, by the grace of God. So it's like we have very few data. Now the one child I'm thinking of that I took care of, he was 18, and he's got immune system issues, and I treated him, and he did great afterwards. Okay, no residual. So, but I'm worried. Like you say, how do you compare a child with autism and who's not being treated, eating dairy, eating sugar, drinking soda, and a child who's gluten-free, dairy-free on a really pristine diet, who's been vitaminized, mineralized, oilized, and this child, and you can't compare the two, and they both get COVID-19. Who do you think is going to do better, right? So to be determined. And hopefully this thing will be gone, long gone, and we won't even be talking about this. Who's ready for this to go? Man, I'm tired of talking about it. All right, so Sophia asks, will PANS continue into adulthood if a child we don't get under control? Can PANS be the reason for a child whose autistic behaviors focus stimming? Absolutely, guys. PANS stands for pediatric, that's the P, A, autoimmune. There's an autoimmune response to something, and that autoimmune response is attacking the brain. We can have an autoimmune response to the thyroid gland, and we call that Hashimoto's. We can have an autoimmune response in the pancreas, which destroys the cells that make insulin, and we call that type 1 diabetes. We can have an autoimmune response to lining in our joint spaces, and we call that arthritis, rheumatoid arthritis. The autoimmune response that we get in PANS or PANDAS, it's a brain thing. So it causes the next word, pediatric autoimmune neuropsychiatric, OCD, tics, repetitive behaviors disorder, that's the D. So now you got the PANS, and then associated with strep. Now, it's PANS if there's not strep involved, pediatric autoimmune neuropsychiatric syndrome, due to something. Just if something happens to be strep, it fits the cute little acronym PANDAS. So that's that thing. So now you're asking about will it persist into adulthood? Again, very, very limited data on that. I mean, when you think about it, Pandas is not been around for very long. So my kids who are Pandas kids, I have to wait until they're into adulthood and see if it's continuing or if the things that we're doing now mitigate it and reverse it. For the autoimmunity issue, sometimes we have to think about different kind of therapies to quell that autoimmune response. Because if you think about it, you can never eradicate yeast from our bodies. You can keep it under control. But some kids, it goes crazy all the time. You can't ever eradicate streptococcus. There's a billion different types of strep, okay? And half the skin flora, half the bacteria living on our skin is Streptococcus epidermis. The other one's Staphylococcus epidermis. So that's why grandma would say if you scratch a mosquito bite, it'll get infected because you're driving the bacteria that's on your skin into a little wound. That's not where it's supposed to be. And it will proliferate and grow and become like impetigo or something. So, don't know. Don't know. It's a good question. Alrighty. Adriana, she says in the UK is warning about adverse reactions in people with a history of significant allergic reactions and seizures that is significant to pay attention to. Absolutely. I mean, my problem with anything that I use, vitamin C, Motrin, Benadryl, antibiotics, vaccines, there's going to be somebody who's not going to do well with it. I mean, that's just medicine. There's in medicine, we're all unique individuals, and we don't all react the same way to everything. Okay, you give my wife a shot of penicillin, and she'll have an anaphylactic reaction. So, or fire ant bite, right? So we just have to be very careful with what we do. And if you have somebody who already has a significantly known compromised immune system, then extra care has to be taken in considering whether the risks and the benefits. It's always risk benefit. We talk about that in medicine, and that's under informed consent. Whenever we do anything in medicine, there is a risk, and there's supposed to be a benefit. So then you have to say, well, do the benefits outweigh the risks? Then we'll go for it. Do the risks outweigh the benefits? Then I don't think so. Okay. So that's something to be definitely considering. Now, don't write anything on this Facebook that's going to get me, thrown off, guys. All right. Then there's MeWe. So if that happens, find me on MeWe, okay? Let's see here. One of the articles said people with disabilities will be getting a shot first. I don't know about that. I did. Again, you have to be careful what you read. Sometimes, if you want to call them journalists, fiction writers, whatever, will write anything to get copy and pasted, and everybody gets disseminated. This such and such person said all autistic kids will get this first, and then of course that gets circulated around the world in less than 30 minutes. So we got to be careful what we're doing. My concern, or at least what I've heard, is that there's going to be a definite distribution protocol. And like I said, I've heard it's the military first, and then first line responders are going to be offered it, as well as hospital and our nursing staffs and all. So we're just going to have to wait and see. But in a week or two, we're gonna figure it out. But again, I have grandparents of my families, and they're so depressed about this whole thing, they can't wait to get the vaccine. They can't wait to get the vaccine so they can get on with their life. They're crying each day to get the vaccine. You have to understand, and this is not you, of course, but this is people around you who have been watching the news and watching the news and watching the news, and it's become a part of who they are. They're willing to give up all their liberties for safety, and the safety that they perceive that they're getting. And we just have to be very mindful that there's a lot of people out there. If you look through their lenses, they're very scared. So let's not get scared about what we read. Let's just wait and see what the actual issue is. And that's a good point. A lot of people worry about things that aren't going to happen. We, especially with children with special needs, have enough things to worry about each day. We don't have to make up or fabricate things down in the future, and we'll just deal with it when they come, if they come, and we'll see. So that's good, that you're looking at this, but be very careful what you read. There's so much false and misleading information out there, purposely placed to antagonize you, to worry you, to make you pass that article on to a friend. Hey, I just read this, and I just read this, and kind of like the old days playing the game telephone. So just be mindful of that, and I'll let you know, through these updates what it looks like it's going to be, and from concerns about, I was just had a family in Australia I was talking about, and she told me, okay, the telephone, she told me that she heard from a friend that she heard that Qantas Airlines will soon be saying if you don't have a COVID vaccine, you're not going to fly on their airline. So that's what I'm saying. There's going to be rumors and rumors and rumors and rumors of rumors of rumors. Let's wait and see what happens before we start worrying about how am I going to get here or there on Qantas if I don't have the vaccine. Let's just wait and see, guys, because even if you did know, say that was the truth, there's nothing you can do about it now anyway. So hang in there, voice of reason. All right, let's see. Any other questions? How are we doing on time today? All right, we got a little more time. Let's see. Radio show questions. This is from Antonis. Hi, Antonis. I was watching your video about CBD the other day, and I have a question. I was watching it on a replay, so you could post the question here. I have an 8-year-old boy with ASD, PDD. He has some words, and so he's communicating better. So that's great news. We are gluten-free, casein-free, dairy-free for 3 years, 75%. I don't know what that means, but okay, I would say. With gluten-free, dairy-free, it's an all or nothing thing. If you have found, and this is for everybody, if you found that your child benefits from a gluten-free, dairy-free diet, it should be 100%. Why would you want to give your kid a little bit of a toxin as a treat? I don't give my children toxins as a treat. If gluten or dairy has proved itself to be toxic to a brain, don't do it. That's silliness, okay? It's not a treat for them. It's a poison. So, for example, if I eat a piece of bread, I don't get hyperactive, I don't get stimmy, I don't get irritable, I don't have a problem sleeping. But if a piece of bread does that to your child, then it's acting as a brain toxin. So let's not do that. Okay. So, also traditional occupational therapy, speech, and we also did neurofeedback. I need to try CBD. That would make him focus a bit for his anxiety, and try CBD before I have a lot of faith in it. I know you refer to Miriam's hemp. I like them too. What would you recommend? What dose? Okay, so Miriam's Hope, hemp.com, they have a very good product. And if CBD is going to work, it's going to work from this company. My problem is there's 10,000 companies making CBD, and some of them are probably quite excellent too. I just don't know who they are, and also I've got involved early with them, and they've been really, really good to our families. They give them a good discount if you have a permanent disability. I use if I'm looking for attention deficit and hyperactivity, I like their product called Daily 25. And then when you order it, you call them on the phone, just don't do it online, and tell them you want the ADHD terpenes added, okay? And dosing is tough. Probably for an 8-year-old, I'd probably start with so you get the 0.25 dropper, I'd probably start with half that and do that twice a day. Just to make sure CBD, again, risk benefit, your child does okay with that amount. So the good news is we didn't see any bad effects. The bad news is we didn't see any good effects. Then I go up to 0.25 twice a day, and then I'll go up to 0.5, 0.75, 1 ml. So 1 ml twice a day, and I think we're seeing some improvements. Then I go from the daily 25 to the daily 50. That means there's twice as much in there. So that 1 ml from daily 25 now becomes a half an ml, okay? And you add the added ADHD terpenes, and then you work your way up. So you have to work with that. Now, there are some kids in my practice who actually need a little bit of THC, and that's medical cannabis now, and that you'll need a cannabis card or recommendation or referral, something depending on what state you're in, okay? to do that. So that's how I do that. I'd probably say that CBDs work about 50-60% of the time. They also can help with anxiety. They can also help with sleep issues. They also can help healing the gut. There's a lot of nice things that you get from the CBD or CBG. And let's see. Stephanie, hi Stephanie, asks, you mentioned clearing throat in your intro. Can you explain why an ASD adult would do that? At that point with an adult, it might be habitual, but it may be a tic, and the tic may be due to strep, and that might be somebody who would benefit from a trial of an antibiotic and an antifungal together. But there's something usually going on with tics. But the throat clearing is generally tic. All right, let's see. I got some more questions up here. Tony writes in, hi Tony. Do you think COVID-19 will mutate? And if so, for the better or for worse? It's already mutating, and it's already becoming less deadly. Okay, so that's the good news, that even though there seems to be a lot of cases with COVID-19, there are fewer deaths for it. So I think it's mutating into a milder form, as many viruses do over time. The PCR testing that they're doing with the cases, PCR testing was never really intended to diagnose. It amplifies the RNA, and it amplifies and amplifies and amplifies it. And you're never supposed to amplify a PCR test, say, greater than 30 cycles. And the tests they have out there are 45. It doesn't tell you whether you have an active virus penetrating your cells, taking over their machinery and making baby viruses, or if it's just inert, just material in there that's not doing anything. So the PCR test is being performed, and I think, again, how you interpret a positive result. So for example, are you more concerned about 5,000 new cases of COVID-19 that are asymptomatic, or 5,000 new cases of COVID-19 that are on their way to the hospital because they can't breathe? Okay, but when you get reports back in the news, you don't know what you're hearing. You don't know how many of those are very sick people, and how many of those just have a cold or pretty much asymptomatic. So you have to be very careful how you interpret, how you internalize what you're hearing on the news about more cases. I also hear about the ICUs being fuller, 75-80% full. Well, when you build a hotel, it's like at Disney, you don't hope for 10% occupancy. You don't have a whole staff, restaurants, front desk crew, cleaning crew, mechanical crew, maintenance crew for 10% occupancy. You're hoping for 90% or better. ICUs are the same way. They have dedicated nursing staffs, respiratory teams, the pharmacy teams, the in-house pharmacy. You've got the respiratory people, you've got the radiology people. You've got a huge staff. You can't pay for them with 10% occupancy. So when you hear that your ICUs are getting full in your particular city or state, you have to say, how is that different than, say, last year? Is it like a 1 or 2% increase? Is it a 90% increase? They don't build them and fully staff them and have everybody sitting around playing Uno. So, again, and you don't get the whole story when you hear things, and it's kind of frustrating. That's why I'm saying that when you hear things on the news and everything, first of all, turn off the news. You shouldn't be watching it. Second of all, when you do hear things come across stuff, you have to sit there and say, okay, is that normal or abnormal? Just like I do with the autism. The kid's not sleeping at night. Normal or abnormal? Abnormal. Alrighty. I think at this point then, in timing, let's see, is there any last minute questions? That's all the questions. Now, if you wrote a question and I don't answer it right now, it's because I don't see it. So email it to us, and I will answer it next week. And we'll talk to you then. In between now, stay well, stay healthy. Don't worry about things you don't have control over. okay? And don't worry about things that people say, because let's wait and see what happens. All right, guys. Love your kids, love each other, and we'll see you next week. Bye now.